My name is Matthew Edwards. I'm an actuary and I'm editor of the actuarial profession's main mortality publication, the Longevity Bulletin. A lot of actuarial work boils down to separating signal from noise. And this involves foundational assumptions which we take so much for granted that we may not bother even to question them. Now, surprisingly, a lot of the public health decisions taken over the last few months of the pandemic relate to the same point. So what is it? Well, it boils down to a notion more familiar in a legal context, that people should be assumed innocent until proven guilty, which of course sounds fine in that context, but in science it's the other way round. We assume that the status quo is good, and we consider any change as guilty, if you like, until proven innocent. So in normal times that works. If we take some chemical, such as a statin, we assume it's harmful until it's gone through a series of tests, and then we would need further trials to check for material benefit and no adverse side effects. This takes a long time, typically of the order of 10 years or so. But in a pandemic, things are clearly different. We need quick responses. If we have good reason to think that something is harmless, but that it may help in the fight against our invisible enemy, then we should try it. We can't wait for years to be sure it's beneficial. There's no time. If it may help but cannot harm, the answer is obvious: act. A good example is face masks. But there are other things we could reasonably regard as harmless which may help. For instance, wearing gloves in shops, or vitamins C and D. With hindsight, it's clear that in the UK we were well prepared for one type of pandemic, but we faced something different and lacked the agility to react well. To my mind, that lack of agility could also be seen in this inability to rethink these basic assumptions about proof, whether we need to prove innocence or prove guilt. Perhaps a wider problem of methodological groupthink. Now, there's no point in ruining past mistakes just for the sake of it, but it's surely important, very important for the next disaster or the next wave, that we're better prepared, more open-minded, more mentally agile. Thanks.